He'll stay and give us more reaction. But the current Saskatchewan Premier is Brad Wall. He's here with us. Premier Wall, we just watched you exit the meeting, and thanks for being here. Some are wondering why the premiers did not have a stronger response to the government. Mr. Charest, Premier Charest, said the premiers were sideswiped by the deal. Why not a stronger response if indeed that deal is unprecedented and unacceptable? Why not a stronger response than we heard today?
Well, reality has to enter into the picture, frankly, and every province is in the process of not just planning budgets for this year, but looking at outlying years. And so, I mean, I heard a bit of that. So if the notion here is that the response should be we're not taking it, it's hardly an option, especially when you consider Atlantic Canadian provinces, some other places where proportionally this funding obviously is very, very important. Let's not forget provinces had asked for, Canadians had asked for 6% escalator beyond 214. Notionally it's there, although as we move to per capita, of course, it impacts all the provinces. Thereafter, it's nominal GDP, so inflation plus the GDP. I believe it's important for us to continue to press the federal government to be a partner, a meaningful partner on innovation. When provinces are prepared, as we have been in Saskatchewan, and every other province has their own example, to set targets for better patient care, let's remember that's what it's about, in a more sustainable system, the federal government ought to be a partner, and we need to continue to work towards that.
Is there a split in the group? In other words, let's say your province, Alberta, and British Columbia, and I spoke to Christy Clark about this. She seems to accept the formula, the basic formula, that after a while, after 2017, the transfer should be tied to, as you say, nominal GDP plus inflation with a floor of 3%. She says we accept that, and she's ready to deal with that. She has a problem with some other elements here, including the non-age adjusted per capita transfer, in other words, not accounting for aging demographics. Let me ask you, do you have a problem with the federal formula as it is, extending the escalator 6% by 2 years and then tying it to nominal GDP?
We were pretty clear that the formula itself wasn't problematic if indeed there was a good faith partnership with the federal government with respect to innovation. Outcomes-based, goal-oriented, target-specified innovation, and if the federal government were going to be a part of that. Disappointing, very disappointed to hear what the Prime Minister said yesterday. And by the way, may I point out, at odds with what his own minister said just days before. Soon as Flaherty made his announcement, provinces weighed in, the unilateral declaration of funding, provinces weighed in. We were one of them that said, well, this isn't very encouraging. We hope there's room for innovation. The Minister of Health said to a national paper, and I think others, the National Minister of Health said, yes, there's going to be room for innovation. And now in the middle of the Premier's conference, the Prime Minister says, no, that's not on.
So what do you make of that? What do you make? Do you feel that you were, in some case then, being led on by the Health Minister? How do you characterize that?
Well, there's either been a change of heart or it's the gang that can't shoot straight and have different stories over a number of days. But the problem is that this is a very, very important issue. This is about health care in the country. This is about health care for Canadians, and significantly, this is about making sure that the health care system is sustainable. We all know what the costs are. But what's the bottom line?
I'm just trying to get the bottom line. I mean, I had Premier Dexter on yesterday, and he said, look, you need to talk, first of all, about the escalator. If you go to nominal GDP, he says, because of that, they will essentially be taking a decreased amount of funding from the feds, and they will not be able to provide the level of care. So we're going to get an asymmetric kind of federalism. So worse health care in Nova Scotia, better in places like Alberta. Do you agree with that assessment?
Well, first of all, it's difficult to separate these different tools of fiscal federalism and comment on each one specifically. For example, the health transfer, the social transfer, and equalization. The health transfer and the social transfer, some would argue, with some validity, is a per capita way to provide funding for Canadians wherever they live in the country, for social services and for health care. Equalization is about something completely different. And I think that's what you saw today. Premiers come together, even though we don't agree on everything, to be sure. We did come together and say, like, Premier Selinger will chair a group of the provincial finance ministers and officials to just determine, to assess the impact of not just this new, the commitment by the feds, but the fact that they're going to move to per capita. And all of this sounds very much like inside baseball. If I was watching the show, Evan, and I'm in Tompkins, Saskatchewan, I'm thinking, well, how does that impact me? Well, the bottom line is we want to make sure we have a sustainable healthcare system, public healthcare system in the country that delivers better care and better value. Those things are not mutually exclusive. We can do them. Be easier with the feds, but if they're not there, we're going to move ahead. Witness the group that will be led by Premier Giz and myself with health ministers in the country, where we're going to look at a number of innovation.
Well, this is what I want to. This is what you and the Premier Giz will co-chair a healthcare innovation working group. Let me just show you a quotation from a clip from Stephen Harper last night. Just listen to what he had to say about that.
The figures on transfers are well known now. I hope the provinces will concentrate on, I think, what Canadians expect, not a debate about money, but really an examination of what we need to do to better deliver healthcare services.
So he's saying we're not going to negotiate about the money, get on with innovation. Now you've got a healthcare innovation working group. So are you de facto accepting, look, we can't negotiate with the feds, we better get on to innovation? Is that what this working group fundamentally is all about?
Yeah. No, this is a process, not an event. I think Premier Romano would be able to confirm that federal governments from time to time have come out with very sort of unequivocal pronouncements with respect to fiscal federalism or other matters of the Confederation, and there's been a change. I think premiers need to work towards that with respect to their involvement. But
even if they're not signaling that. So you're just saying you hope they change their mind, even though you got to admit, and I'm sure you watched Stephen Harper last night, he was not very equivocal about it.
I think the federal Liberal government was pretty unequivocal about not moving significantly on health transfers prior to the accord that was struck in, I think it was 2004, that led to where we are today. And so I'm not one to say never. I think that's a dangerous proposition in politics. I'm also one to, and so are the premiers, we want to work towards something better. But in the meantime, Evan, we're not going to wait on that. We're going to move ahead with innovation. And I heard what Premier Romano said about some of these things being tried and looked at already. I think there's some work that needs to be done. One part you haven't talked about yet today that Premier Giz and I will be working on with health ministers is that we want to make sure provinces are cooperating and coordinating on human resources. 73% of healthcare costs in the province of Saskatchewan, and about that number right across the country in provincial health systems, is human resources, wages, salaries, benefits. So we need providers to be a part of this discussion. We need to stop competing for healthcare workers province to province. And though we've talked about it in the past, we now have a formalized process in this working group to make sure that cooperation's happening, even as we listen to those providers about best clinical standards that we can adopt and scope of practice issues and counsel they'll have for us.
Let's talk about this innovation. You've talked about the use of private clinics paid for through the public system for surgeries to alleviate wait times, and you've talked about that. When people talk about innovation, a lot of people think that's a code word for allowing more private health care and rolling back where universal coverage begins and ends. And really, this is what we're talking about with innovation. What's your definition of innovation? Are we about to see private interest within a single-payer system?
No. Innovation is about improving healthcare, better health, better care, and do it with providing better value, so more efficiently. We're not just talking about the private clinics, we're doing it in the province and have for some time. They're part of the reason why wait times have come down. People waiting longer than 18 months for surgery in Saskatchewan is down 83%. People waiting 12 months and longer is down 60%. People waiting 6 months and longer is down almost half. So they're not the only reason why that's happening, but they're a part of it. And that's innovation. But what Nova Scotia does in terms of deploying nurses in emergency rooms to keep them operational, the greater use of nurse practitioners in the system, especially in rural and remote areas. These are also examples of innovation where we are delivering equal or better service, doing it differently, maybe doing it more efficiently, and contributing to the long-term sustainability of the system. Public health care, universal health care, is the principle upon which we're working. But within that principle, we better get creative to deliver better care and do it in a way that's sustainable.
Last question. A lot of this is about the reshaping of a federal role and a provincial role. The feds used to fund healthcare at 50%. Now it's down to 20%. Premier Dexter told me it could fall under 20%. What does this tell you about federal-provincial relations? Are they at a low? Are we seeing a serious conflict over, I mean, I know you want a dialogue here, but right now, Are we seeing federal-provincial relationships at a real low?
Well, with respect to this particular meeting and this particular issue, it's certainly not a high, that's for sure. I think each province can point to, and we can too, to some significant success in terms of the bilateral relationship with the federal government. But in this particular issue, this isn't that we're not in a very good spot. We're going to continue to work to improve it, but that's the short answer to your question, Evan. This isn't particularly good for the country. That needs to be improving healthcare right across Canada for all Canadians. And we need the funding partners there, and we need the providers there. That means the federal government has to be a part of that.
Premier Wall, it's always good to talk to you. I appreciate you coming right out after that meeting to give us the latest on what happened and the next steps forward. Thank you, sir.
Thanks, Evan. Hello to former Premier Romano.
He's listening.